Friends, how are you today? I hope you're doing well. Good. Welcome to the Alex Toast Medical Marijuana Logs. We're already up to episode number 4. Holy crap, time is just flying by. I'm still up in Rhode Island at the 6th National Conference on Cannabis Therapeutics. Check it out. I got a couple really cool books today. I got this big old honkin' textbook that's like 600 pages long. It's called The Biology of Marijuana. It's a pretty freaking crazy book. A lot of really interesting scientific looking biological diagrams and things like that. I don't know what that means. I haven't gotten to that point in the middle of the book yet. But either way, that's going to be fun. Also got this really cool book called Buds. It's the 3rd edition of Buds. I don't have the other editions at all yet, but it's a good series. It's got a lot of cool pictures of different strains of marijuana, and there are different things involving how long it takes for them to germinate and do how much yield they have. All these crazy different things about different specific strains of marijuana. Pretty cool reading. It's got a lot of beautiful pictures. What's today's episode going to be about? It's going to be about the scheduling of marijuana. It's currently a Schedule 1 drug. Not cool. It makes it so a lot of research institutions have a lot of difficulties getting any sort of grants or permissions to research the chemical. A lot of times the research that is done on it is viewed on it from a negative perspective, trying to find the negative effects of it. In order for a drug to be considered a Schedule 1 drug, it has to fit 3 different criteria. It has to have a high potential for abuse, has to have no currently accepted medical use and treatment in the United States, and it has to lack an accepted safety for use under medical supervision. Okay, cannabis doesn't really fit any of those. It's really ridiculous. So first one, high potential for abuse. As a drug, the National Institute of Drug Abuse, or NIDA, rated cannabis to be less addictive than other drugs listed in Schedule 1 and other schedules than just Schedule 1. Some of the Schedule 1 drugs that it's more addictive than are heroin, MDMA, methamphetamine, PCP, just a few of them. There are a bunch. NIDA also rated cannabis to be less addictive than nicotine, alcohol, and caffeine. All of these are substances that are legal and pushed in our face. We're encouraged to purchase these every day. And they're more addictive than cannabis. Yet cannabis is a Schedule 1 drug that's considered to have a high potential for abuse. Crazy, crazy stuff. Cocaine isn't even a Schedule 1 drug. It's a Schedule 2 drug. Crazy. Number 2, it has no currently accepted medical use and treatment in the United States. Oh, it's really interesting that 14 states and Washington, D.C. currently have medical marijuana laws, and 14 other states are trying to push for more medical marijuana laws. So these states have found medical uses for cannabis, and not only have these states found medical use, but so have thousands and thousands of patients that have testimonies on record. And also, a group called the Center for Medicinal Cannabis Research, or CMCR for short, was issued $8.7 million in the year 2000 after California passed an amendment granting them this money. And that $8.7 million was to be spent on conducting different studies involving cannabis through the University of California. To date, there have been 6 completed clinical studies, and 5 of them have been published in scientific journals, with one more pending the publication. The scientific journals that they've been published in so far have been in the journals of Neurology, Neuropsychopharmacology, Journal of Pain, Anesthesiology, and Clinical Pharmacology and Therapeutics. The results of these studies that have been published prove marijuana's efficacy in treating pains associated with HIV/AIDS, chemical radiation, a lot of times with cancer patients, multiple sclerosis, and neuropathy. There have also been numerous studies done around the world which also show marijuana's efficacy. It's pretty crazy that all these different laws are passing, and all these different areas around the world just happen to have noticed cannabis's efficacy and have proof of it. It hasn't killed anybody yet. Really, really, really crazy that it's considered to have no currently accepted medical use. It has a lot of accepted medical uses. What I've been hearing over the last couple days, there is medical use for marijuana. So number 3, it lacks it lacks an accepted safety for use under medical supervision. So one of the studies that was published for the Center for Medicinal Cannabis Research, CMCR, out of California, demonstrated that there is a suggested therapeutic window for pain relief from marijuana, suggesting that an optimal dosage of THC for a patient can be achieved. There have also been numerous studies, there have also been numerous marijuana testing facilities opening up in states with marijuana laws that test specific chemical compositions of different strains of marijuana. They don't just look for THC, they test it for mold and fungus to make sure that, and mites and stuff like that, to make sure the patients aren't taking in anything that's bad for them. They also test the specific chemicals that are in it, like the amount of THC, the amount of CBD, the amount of CBN, and other different cannabinoids that are in marijuana as well. One example of this is a Harborside dispensary in Oakland, California, whose operator I had the privilege of listening to present yesterday. That's a nonprofit organization that spent a lot of its extra funding to create an extensive testing facility which can give patients a more accurate idea of what chemicals they're putting into bodies, and therefore giving them the ability to go into a marijuana care center and ask the dispensary people who or what best fits their condition, and how much of these chemicals, the different amounts of them, what that's going to do to them more specifically, so they can more accurately assess what is best for them. And not to mention, there's never been one recorded death involving an overdose of marijuana. So I mean, accepted safety for use under medical supervision, I'm pretty sure it's pretty safe. In its thousands of years of use on Earth, there hasn't been any recorded death from an overdose of it. I'd say it's pretty safe, actually. A lot of things I've learned show that it's actually really safe and can actually help the human body. Crazy. So to say that it lacks an accepted safety for use under medical supervision is not correct. So I just went through all three things, all three criteria that it has to meet to be a Schedule 1 drug, and it doesn't meet any of them. So why is it still a Schedule 1 drug? We're actually in the process, we have been for a long time. By we, I mean marijuana activists. I guess I'm still pretty new at this, so I haven't been involved for too long. But other organizations are instituting a petition to the DEA to reschedule marijuana. So sign that if there's something online available. Look it up. I have to do that myself here tonight. But make it so that it can be tested further. If it's Schedule 1, it's really ridiculously difficult to test it. So if it's not a Schedule 1, a lot more testing will be done, and we will learn a lot more about this. So that's that for today. A lot of good stuff from the conference today, and I'll get to that over time here. But I'm looking down here because well, I'm wearing another tie. Another one. Third tie. I forgot I didn't wear one on the first night. So, this is this week's clue. I like animals. Woohoo! So, this tie. Dun dun dun. Drum roll! Oh! It's a chicken! It's a chicken! I think it's a dead rubber chicken. Whoa! Crazy. I dig it a lot. Oh, it is a rubber chicken because it says rubber chicken on the back. Woohoo! So, yeah, that's that. Thanks a lot for tuning in. This has been the 4th episode of the Alex Toast Medical Marijuana Logs. And actually, I think I'll most likely be maybe doing a double feature tonight. I plan on interviewing a group of people from the Cannabis Health News magazine who are down the hall here, probably in a little bit. So, thanks a lot for tuning in, and have a good day.